What are all the extraoral defects? Commonly, ocular defects, orbital defects, nasal defects, ear defects, cranial defects, and some miscellaneous defects. How are you going to do the prosthetic rehabilitation of the extraoral defects? Ocular prosthesis, orbital prosthesis with nasal prosthesis, ear prosthesis, and cranial prosthesis. What are the defect that we had? For that, we have to use this kind of the prosthesis to rehabilitation. Evisceration and ocular prosthesis. Whenever the patient is going to lose the eye, it means, in other ways we can say, if patient has lost part of the eyeball, that is called as evisceration. For that, prosthodontist will fabricate ocular prosthesis. Patient who lost part of the eyeball is here. We have made an impression. This is the impression of silicon impression has been made. Ocular prosthesis fabricated and inserted in the patient eye. So we will be able to make a ocular prosthesis the patient who have lost part of the eye. That is called as evisceration. Sometimes the patients will lose entire lobe of the eye. So that is called as enucleation. So whole part of the eyeball was removed here. So patient is both upper and lower eyelids are closed. So we have to stretch it, make an impression, fabricate ocular prosthesis and put it inner side. But this is not functional. Previously, there was an eyeball. Whenever the eyeball is moving, even the prosthesis also will move supero-inferiorly and mediolaterally. But the enucleated socket we fabricated ocular prosthesis, this will not move. This is only for the static position, only for aesthetic purpose, and it will not move at all. There is a lot of difference between the ocular prosthesis made for evisceration cases and enucleation cases. Just it is going to fill up that socket and provide some aesthetics. Only the patient can move the upper and lower eyelid, not the prosthesis. This is the orbital exenteration. Patient will lose entire eye component. We can say in the enucleation, patient has lost only the entire eye, but upper and lower eyelids were intact. But here, entire eye and upper eyelid, lower eyelid also removed. This is called as exenteration. Most of the situations will happen cancer resections. I think we have come across class 4 situations, brown class 4 situations. The maxillectomy was done. It was extended into the orbit, so the orbital exenteration was done. For this patient, he underwent class 4 maxillectomy, brown maxillectomy procedures. So we fabricated the obturator, definitive obturator. Over the obturator, we fabricated the orbital prosthesis. The orbital prosthesis is anatomically retained, and we have given little bit of retention with the help of spectacle also. So this is called as orbital prosthesis for orbital exenteration cases. Ear prosthesis, spectacle retained ear prosthesis. This is example for spectacle retained ear prosthesis because patient who lost the ear because of a trauma, it is a road traffic accident. Patient who lost the ear because of chemical injury, fabricated hair band retained prosthesis and given to the patient. Patient has got a Treacher-Collins syndrome. There is no ear at all. There is a microtia. Small ear was here, both right hand side and left hand side. Even that was excised. We have given a hair band retained ear prosthesis. It is called as bilateral ear prosthesis. Bilateral ear prosthesis, and the hair band was camouflaged with the help of cap. This is a congenital anosia and atresia. There is no external acoustic meatus for this patient, and even the teeth, so even the ears also. Hairband retained ear prosthesis. The example for hairband retained ear prosthesis bilaterally. When you give proper prosthesis, even the hairstyle also changed because there is no ear. She has to camouflage the ear area with the help of hair. So when we fabricated the ear prosthesis, patient is exposing the ear and want to show that she is having an ear with jewelry. This patient is congenitally missing ear. This is anosia. This is actually called as not anosia. This is called as microtia. This is called as ear. This is a ear. This is a tragus of the ear. For this patient, we fabricated the adhesive retained ear prosthesis. This is called as adhesive retained ear prosthesis. We have to stick the ear with the help of medical adhesive. The adhesive power will be there for at least 8 hours. It is a working hour, 8 hours. Then you have to remove and clean it. When you go for next day to the office, you can wear and go. Same patient we have changed into the implant retained ear prosthesis. We placed 2 implant here. There is a bar and clip is attached later. This is retained with the implant retained ear prosthesis. There is a various kind of retention. You can say hairband retained, spectacle retained, anatomically retained, adhesive retained, and implant retained prosthesis. This is a facial prosthesis. Patients got a resection in the right side maxilla and orbital exenteration also. So we fabricated the obturator and the orbital exenteration. There is a lot of defect because bone has been removed, that we have to do the prosthetic reconstruction of the almost half of the face. So we have fabricated the facial prosthesis. This is a facial prosthesis. Just you can have a look. This is adhesive retained and spectacle retained.